morning, everyone. Welcome to our presentation. First of all, thank you for coming today. As you can see on the screen, our topic today is medical ward equipment. As usual, I'm gonna mention the member of my group before we start the presentations. This group consists of 7 members. There are Balkis, Baby Aska, Hafidah, Nabila, Salsabila, Halimah, and Zulfa. Here is our overview project. Today we're gonna talk about definitions, use and how to use. The first slide will be explained by Hafidah.
Part 2 set. Definition. A parturition set is a set of surgical tools used by medical staff for normal childbirth uses. Every tool has its own uses to support normal delivery. Also, every tools are involved in this action. How to use. Some of them work like scissors. Next slide. Dilly balloon. Definition. A dilly balloon is a tool used to suck out dirt or mucus for the nose or ears to facilitate nasal breathing and remove dirt from the ears. Uses. The function of these tools is to suck out the mucus in the baby's or child's nose. How to use. The way it works is almost the same as a vacuum cleaner, but this mucus suction device uses manual power instead of power machine. Doppler. Definition. A Doppler fetal monitor is handheld ultrasound transducer used to detect the fetal heartbeat for prenatal care. It uses the Doppler effect to provide an audible simulation of the heartbeat. How to use. Patient lay down with an electronic sensor belt around the belly that continuously records the baby's heartbeat. Next slide. CTG or cardiotocography. Definition. Cardiotocography or CTG is a continuous recording of the fetal heart rate obtained via an ultrasound transducer placed on the mother abdomen. Uses. CTG is widely used in pregnancy as a method of assessing fetal well-being, predominantly in pregnancies with increased risk of complication. How to use. For the test, you lie down with an electronic sensor belt around your belly that continuously records the baby heartbeat. Next slide. Vaginal speculum. Definition. A vaginal speculum is a tool that is usually used by midwife as a tool to open the vulva with the aim of facilitate examination or medical procedure. Uses. To open the vulva and reach cervix. How to use. This tool gonna be placed inside the vulva to start examination. The next slide by Aska.
Okay, thank you. The next is oxytocin. The definition is oxytocin is a form of artificial hormone that has many uses. One of them is to help the birthing process. Uses to stimulate strong contractions in the uterine wall, making it easier to assist in the birth process. How to use. It's gonna given by injection it into a muscle or through an IV. Next. Vitamin K, the definition is vitamin K as phytomenadione. 1 milligram single dose can be given intramuscularly at birth. This prevents bleeding due to vitamin K deficiency in babies. For premature babies, 400 mcg or kg between maximum 1 milligram can be given. Uses is to prevent intracranial hemorrhage. How to use by giving a vitamin K injection into the baby's thigh muscles after birth. Next. Next, infusion pole. The definition is an infusion pole is a tool that functions to place infusion fluids that are connected to the patient. How to use to place fluids connected to the patient. Uses is hang the liquid connects to the patient on a pole branch. Next. Next is crook. Definition: a crook is a temporary container used to place instruments that have been contaminated with blood, feces, or other body fluids when performing medical procedures. Uses: throw away used cotton, used gauze, pus, blood, or temporarily store dirty equipment before decontaminating. How to use: put gauze or other hard materials that are dirty in the container. Next. Eye ointment. The definition is this eye ointment is given to prevent infection or inflammation of the eyes. Uses: the function is to prevent infections in the baby's eyes. How to use: apply a little ointment to the baby's eyes. The next slide will be presented by Nabila.
Sterile surgical gloves. Definition: sterile surgical gloves are gloves commonly by medical personnel to protect against pathogen droplets. Use: the purpose of using a hand screen is to prevent cross-infection and prevent the transmission of germs. How to use: make sure you have washed your hands in 6 steps. The first step is to open the sterile package. Remove the package from the package. Take the glove for your dominant hand. Put your dominant hand in the glove. Put on the second glove. Adjust the position of the glove. Next slide. Auto underbreath. Definition: auto underbreath is a one-time use sheet that is used as a base to absorb fluids from the body to prevent leaks on the bed. This product is made from absorbent gel which will work in the liquid to keep it dry and comfortable. Use: to accommodate bleeding or fluid discharge in the patient. How to use: place it on the part that produces bleeding or fluid in the patient, such as the buttocks of postpartum bleeding occurs. Next slide. Umbilical cord clamps. Definition: newborn baby umbilical cord clamps are medical equipment that has the function of clipping the umbilical cord that has just been cut from the placenta. Used to prevent bleeding in the navel in newborn babies. How to use: wrap the umbilical cord that has been clamped with the umbilical cord clamp with sterile gauze. Make sure the clamp is locked tightly to prevent umbilical cord bleeding. Next slide. Spread definition. A syringe or a spread is a simple piston pump for injection or sucking liquid or gas. The syringe consists of a tube with a piston inside that comes out the back end, used to enter certain drugs or fluid into the body. How to use: the liquid will be put into the body of the syringe and then injected via a thin needle through the surface of the skin. Next slide. Half cooker. Definition. Half cooker. 1/2 cooker is a medical instrument used to break amniotic fluid of perforate membranes that have not yet ruptured. How to use? Wash your hands, examine DGG, wear sterile gloves, examine internally, hold half of the cooker or kelly using the other hand, and insert it into the vagina with the protection of the fingers of the right hand wearing the glove until it touches the amniotic membrane carefully. After both fingers are in the carpal canal, the position of the fingers is such a way that the palm faces upwards. When his start is reduced, the left hand then insert a special hook into the birth canal with the guidance of the two fingers that are already inside. The outside hand then manipulates the special hook to be able to perture and tear the amniotic membrane 1 until 2 cm until it breaks. Using half a cooker on the tip with sharp teeth stirrup inserted into the cervical canal with the protection of the fingers. Let the amniotic fluid wet the finger used for the examination pull out with the left hand. 1/2 cooker or kelly and immerse it and a 0.5% chlorine solution. Make sure that the fetal head has disinfected and that there are no small ants attached to it after the action is completed. Okay, the next presentation will be explained by Halma.
Baby scales. Definition. A baby weight scale is a tool used to measure a baby's weight. Used to measure the baby's weight. How to use? Part the scale on a flat place. Press the on button on the scale. Measure the number is 0. Then pat the baby on the scale and record the baby's weight result. Next one. Soft-tech maternity. Definition. Soft-tech maternity is maternity napkin with a length of 45 centimeter uses for a mother who has just given birth or during the postpartum period. How to use? Take the eight first part of the pad through your underwear. Next slide. Infantometer. Definition. A baby measure tool for babies and toddlers. Users measure the baby weight of children aged 0 until 24 months or who can yet stand. How to use? Lay the baby and the measure tool of a flat surface to measure the length of the baby's body. Two people are needed to help measure and direct the baby's health so that is the perpendicular. Then look and record how long the baby is. Next slide. Hepatitis B vaccine. Definition: a type of vaccine that includes mandatory immunization for babies. According to the American Academy of Pediatrics, the hepatitis B vaccine given the babies before they are 24 hours old, the effective in preventing transmission of hepatitis B infection from mother to baby. Uses to prevent hepatitis B virus infection which causes liver disorders. How to use? The liquid will be packed into the body of strain and then injection via thin needle through the surface of the skin. Next slide. Resuscitation table. Definition: medical equipment specially designed to provide first aid and emergency medical care to born babies. uses used to place babies or small patients who need medical treatment. For example, babies need to given medical treatment, artificial respiration, or resuscitation. Measure the baby, bathing the baby, and so on. How to use? Place the baby on the resuscitation table by activating the device. The next slide will be explained by Samson.
Forceps. Definition. Forceps are a tool shaped like two large spoons, used to clamp the baby's head and pull it out of the vagina. How to use? Between contraction, insert the forceps into the vagina until it touches the baby's head. There are two forceps clamps which are joined by a handle as a handle. When it has entered the vagina, place one of the forceps on the side of the baby's head. But definition, one of the places for childbirth. Uses for childbirth. How to use? The patient is helped to lie down or position according to the situation. Dilation catheter. Definition, dilation catheter is a flexible tube, pipe, or hose used for short-term urine drainage. Used for short-term bladder catheterization. How to use? Put some antiseptic jelly on the tip of the catheter without touching the tip of the catheter. Advance the catheter into the urethra to its full length to the bladder. Once the catheter reaches the bladder, the urine starts to come out. Collect the urine into the urine bag. Hectating needle. Hectating needle is an instrument used in surgery. Its function is to stitch wounds. Next. Medical spotlight. Medical spotlight, which are often also known as surgical lights or operating lights, were originally made for surgical purposes in hospital. Surgical lights has the ability to focus light to a certain points or area with a very high light level. This allows doctor or health worker to have an optimal view of the area to be operated or examined. The next presentation will be presented by Zulfa.
Okay, the next is baby treat. Product is equipment that every mother must have, whatever says about to give birth or after giving birth. As the name suggests, the main functions of a bed wetting mat is as a bed for wetting the bed. Product is made from waterproof material so it will not get wet or penetrate water or baby pee. Next, patient identification bracelets. Patient identification bracelets are required to help identify patients. Patients admitted to hospital must wear an ID bracelet. The identify bracelets contains 3 important data such as the patient's name, data of birth, and medical record or medical record number. The bracelets used by patient functions to provide early warning to health workers. Sterile option gloves. Option gloves are sterile latex gloves for medical needs in the professions of obstetrics or gynecology and options, disposable with USB absorbable dusting powder coating. It has a length of 56 cm, which can cover the hand up to the elbow. Cause tampons. Definitions. Tampons are a type of cylindrical sanitary napkin made of soft cotton, uses to absorb the blood flow that comes out during menstruations. How to use? 1. Make sure your hands are clean. 2. Use the one that has just been opened. 3. Check the tray at the end. 4. Positions your body comfortably. 5. Answer it carefully. 6. Make sure the threads stay on the outside. Okay, the next presentation will be explained by Balkis.
Okay, jug. Definition: a jug is a place to store water shaped like a teapot made of clay. Uses a place to store the placenta. How to use: put the placenta in it before burying it in the ground as is tradition. Cloth. Definition: cloth that has batik motif with various patterns. Uses to make it easier for the mother to move. How to use: just wrap loosely around the mother's stomach. Mother clothes. Definition: maternity equipment that you shall not forget to bring, like negligee, clothes, and loose clothes. Uses to facilitate breastfeeding or blood tests. How to use: like wearing normal clothes. Baby clothes. Definition: newborn baby equipment that you shouldn't forget to bring. Uses to protect baby skin and absorb sweat. How to use: like wearing normal clothes.
Okay, that's all for our today's topic about medical ward for normal childbirth. Thank you for your attention.